So I'm also going to take a few more minutes than I might have otherwise just to talk very briefly about AdvaMedDiagnostics and the field of diagnostics before I turn it over to our two speakers, whom I will introduce very briefly in a moment. So thanks again for coming. I thought I would provide just a couple of comments on AdvaMedDiagnostics, or AdvaMedDx. We were created in 2010 as a division of AdvaMed, the Medical Device Trade Association. And we function essentially as an association within an association, representing 80 companies that manufacture medical diagnostic tests. I'll talk more in a minute about exactly what medical diagnostics are. And we advocate for the power of these tests to promote wellness, improve care, and advance public health. And as I said, DX stands for diagnostics. It's very much an inside baseball term. We're hoping people will gradually adopt it, much like RX denotes prescription. And one of the many stats that we like to put out there is that diagnostics account for about 2% of Medicare spending, but influence 70% or more of medical decision making. And it's just generally indicative of the leverage of the power of diagnostics. And why is this the case? Well, it's the case because diagnostics span really the entire continuum of healthcare. They are tests that are useful in providing information for clinicians and patients at pretty much every stage of health and treatment. Diagnostics, as I'll get more to in a minute, are essentially tests that are done on samples taken from the body. So they may be fluid samples of various kinds, tissue samples, tests that look for molecular markers like genetic sequences or particular proteins. And again, I'll get more into that. There will be a quiz at the end of the briefing on this chart, so please pay attention in the next 2 minutes before I take it down. No, seriously, actually this chart is available on our website, as is a lot more information, so you don't even need to take notes. But I put it up here to indicate the point that I was making here, that diagnostics are used in really the entire continuum. So they can be used up front in asymptomatic patients for, of course, as you're familiar with things like screening for cancer. So you can look at whole, wide populations of people to see if they've got something that you don't have any symptoms of. So for screening and early detection of disease. Used for diagnosis. So someone presents with symptoms and a clinician is obviously trying to figure out what's the matter. There's a whole range of tests that are useful in diagnosis. And they're also useful for determining what stage of disease a patient is in, for making prognoses about how the disease might progress in a patient, and then used in selecting appropriate treatment, whether it's drug selection or other treatments indicating sort of what's appropriate for this patient, this disease, what stage of disease, and so forth. And then in follow-up care, monitoring the course of treatment. Is this drug working? Do we need to change a dosage? Do we need to switch to some other therapy entirely? And even post-treatment, how's this patient doing? Is this patient still in remission? Have they fully recovered? Do we need to come back for regular checkups? Diagnostics are useful across this whole continuum, and that's, again, why this information shows up in so many healthcare records and are highly influential in the decisions that clinicians make every day about patient care. Very briefly, because we could do a whole seminar on technologies in diagnostics, and you'll hear a little more about a few of these from our speakers. Diagnostics cover a wide range of essentially life sciences technologies. In general chemistry, urinalysis, for example, test strips for urinalysis, blood sugar levels and so forth for diabetes. Immunochemistry, looking at the body's immune system response, looking at antibody levels and so forth. Hematology and cytology, studying blood or other cells for looking at the pathology of cells or blood count levels, for example, or Pap tests, which of course you've heard about. Diagnostics in the area of microbiology or infectious disease, looking, of course, for the presence of foreign agents, and doing that through blood or urine or other samples. And then, of course, the area that produces a lot of the buzzwords these days around personalized medicine, companion diagnostics, and so forth, the area of molecular diagnostics, which are frequently looking for various genetic sequences, maybe a combination of genetic sequences that are indicative of a particular condition, or maybe indicative of a patient's susceptibility to a certain kind of treatment. Or looking for proteins of various kinds, again at the molecular level. And these are, of course, across the board and all the spectrum of technologies, diagnostics are extremely powerful. The area that, of course, that we are particularly excited about are advances in the molecular side. We're not really here to talk today in general about that, but certainly encourage you to do some more research on what's going on in molecular medicine, personalized care. It's fascinating transformation in this field, and diagnostics are really driving what's going on in this area. So the technologies, as I said, are these tests are performed on a variety of samples taken from the body, and can be and are utilized really down at the individual level, the lab technician working on a particular sample in the lab, all the way up to this kind of machine. This is a recently approved, FDA-approved platform from one of our member companies that does nucleic acid testing and can process 500 samples in about 12 hours. It's a tremendous advance in the kind of the automation isn't the same kind of automation that a number of our companies provide to laboratories, expedites processing, almost labor-free. Once samples are put into the machine, everything is pretty much automated. And again, just indicative of the kinds of power that technology is bringing in the diagnostics field. And these technologies are responsible for this kind of critical insight. One area that is really taking off in diagnostics and continues to be, I think, of growing importance are point-of-care tests. And obviously that's really the topic today, particularly point-of-care tests in critical care settings and situations. These are a couple of well-known point-of-care diagnostics that our companies bring to the market that you'd be familiar with. Diabetes testing, pregnancy testing available over the counter in your local drugstore. And although I look at this picture and I think it's pretty obvious, I don't know that this woman needed to actually take a pregnancy test to figure out what was going on. But of course, millions of women take advantage of these tests. And point-of-care tests also exist. I mean, it's over-the-counter, essentially, consumer-available point-of-care tests and other drug abuse testing, some HIV testing, sexually transmitted diseases of other kinds. So point-of-care tests certainly represent a range of diagnostics available directly to consumers. But this is all, again, indicative of the diagnostics really growing in point-of-care applications or perhaps point of need. And we talk about laboratory tests, and certainly many of our tests are performed in what are known as laboratories. But increasingly, diagnostics industry is looking to produce tests that can be used outside of the laboratory, whether it's directly in a consumer use in the home, or in particularly focusing globally on diagnostics that can be used in low-resource settings. And I'll talk more about that briefly when we talk about DARPA. Diagnostics can be used when you don't have access to electricity or cold storage or clean water and so forth. This is a growing field, certainly important for developing countries and to a certain extent here in the US as well. So the area of point-of-care diagnostics is something that the Department of Defense is focusing on, and Lieutenant Colonel Wattendorf would have spoken at significantly greater length about this. So I just wanted to give a couple reference points on this topic. DARPA, the Defense Advanced Research Projects Agency, established to prevent strategic surprise from negatively impacting U.S. national security and create strategic surprise for U.S. adversaries, which I think basically means sneak up on them before they sneak up on us. And you can find a lot more about what DARPA is doing on their website, which I've provided here. But specifically, one of the things that DARPA is looking at through its Defense Sciences Office are how diagnostics can be used to protect troops, for force protection, for early advanced warnings around various kinds of attack, whether they be biological, chemical, nuclear, and so forth, and also just to maintain health of troops in a variety of settings. And you can see the quote here from Lieutenant Wattendorf talking about the need for continued direction in point of care, and DARPA's investing resources in trying to help companies develop diagnostics specifically tailored for the kinds of needs of our military abroad. And I talked just a moment ago about limited resource settings. So if you're in the field, are there technologies that troops can carry with them that they can use pretty much on the field without any other resources, self-contained kits and so forth? They can take a sample themselves, provide some results, and then as well, perhaps collect specimens that they can bring back with them for further follow-up and analysis. So that, in a nutshell, is one of the key focuses of DARPA's program. If you go specifically to the Defense Office's portion of that website, you'll see more information on this Autonomous Diagnostics to Enable Prevention and Therapeutics program. And so there's a lot going on, obviously relevant to the military. And of course, when we come a little bit later to talk about traumatic brain injury, of course, there's significant interest to the military as well, and Dr. Streeter will talk about that. So I'll just conclude by pointing out that our website provides a number of resources on diagnostics. I encourage you to visit it and let us know if you think there's something missing. We're building it out all the time. And I would also refer you to Lab Tests Online. It's a fantastic resource. It might even be something to point constituents to, actually. It is a thorough compendium of all the kinds of diagnostic tests that are out there and what diseases they look for. And it's a simple explanation for a patient kind of consumer to find out sort of, if I have this disease, what kind of test might my clinician use? Or I've had this test, what the heck does it mean? I don't understand it at all. It's a great resource. I highly recommend it. So with that, I want to briefly introduce both our speakers, who I'll invite to come up in sequence. I will not read their entire bios, which you have. Obviously, both of them are distinguished. Dr. Frank Peacock is now with Baylor College of Medicine, where he's on the faculty and a professor, and he is the Emergency Medicine Research Director. And he will talk about the utility of point-of-care diagnostics in the emergency room setting in particular. And then after his remarks, we'll hear from Dr. Jackson Streeter, who is CEO of Banyan Biomarkers, which is doing work to bring a new diagnostic for traumatic brain injury to the market. And he will talk, of course, about the unmet need in that area and the science behind the product that they're currently developing and have in clinical trials. I do also want to point out that we're expecting Congresswoman Lois Capps to come in and make brief remarks. Probably she will be here maybe shortly after Dr. Peacock's remarks, or maybe when Dr. Streeter's coming, and we'll just interrupt whoever's on the podium with apologies to our speakers when the Congresswoman comes in and invite her to make a few remarks.